Dr. David Reath, and I'm a plastic surgeon in Knoxville, Tennessee. I wanted to take a minute to talk about a somewhat popular type of breast implant, the so-called gummy bear implants, which we really refer to on a more technical level as highly cohesive gel implants. I think that there's a misconception that many people have that these implants are actually a solid implant, squishy but solid, in the same way that a gummy bear candy is. And that is, with a gummy bear candy, you don't really have a component of an outside or an inside. It's all sort of the same thing. And that's not the case with the highly cohesive gel implants, which have been called gummy bear implants, and they're not called that by their manufacturers, but by a plastic surgeon, because it was a cute name, and it is. But I think it's misleading. If you take a gummy bear implant and you cut it open, you're going to find that you have an outer shell, and it's filled with silicone gel. Now, the gel in this implant is more cohesive than the gel in the cohesive gel implants, these being the highly cohesive gel implants. But it's a spectrum. The fact of the matter is, you have a filling and you have an outer shell. It's just with the highly cohesive gel implants, that filling sort of sticks together a little bit better, but it's still a gel. And I think that this has given rise to the thought in some people's mind that these quote-unquote gummy bear implants will last forever. They can never rupture because there's just one thing together. And that's not the case. They're very much more similar, actually, to the other silicone gel implants than they would be to, say, a gummy bear candy. So it's one of those things that can creep into people's minds, but I think that you have to realize that all the silicone gel implants are along a spectrum of having more or less cohesivity, but they all have pretty much the same structure.